Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Today's show addresses one of the greatest fears of aging, dementia. Dementia is more than sometimes grasping for the right word or misplacing your car keys. Dementia is a category of disease that causes loss of memory and other mental functions, and it can't be cured. It robs a person of independence and steals precious time with family. I'm Beth Brown, your host. Welcome to Healthy Living for Life, a show designed to help you do just that. Stay tuned. Welcome back. My first guest today is Pamela Longmire. Pamela works with Mountain Pacific as a quality improvement specialist who works with nursing homes to improve resident care. Welcome, Pamela. Thanks so much for being with us this morning.
Hi, Beth. Thanks for having me.
Can we start out by talking a little bit about, when it comes to our brains, what is normal aging?
So we all notice our bodies slowing down as we age, but what we don't think about is our brains slow down too. So think of it this way. Throughout your life, your processing speed is getting faster and faster. It peaks out at about 25 to 30. At that point, once you've peaked, you start to lose half a second of processing speed a year. Now you might think, half a second, what's that? Till you get to 40. So once you reach 40, what you might start to notice is I might say, hey Beth, can you get me a glass of water? And you'll say, I didn't hear you. You want a glass of what? And before I can even say water, you'll go, oh yeah, I'll get you water. That's processing speed. So what we're trying to do is say, oh, I'm sorry, I didn't hear you, when in fact it's just your processing speed. In addition to that, you continue throughout your whole life to acquire new knowledge and more information. So if you think of your brain as a file cabinet, now you have to go through all these files and find the right information.
Okay, so when we talk about our brain slowing down a little bit, that also applies to what we can and can't remember. But there is some normal forgetfulness that happens. Can you talk about the difference between normal and abnormal forgetfulness?
Yeah, and I always think that having a prop helps. So if I have this, and I know it's a key, but I can't think of the word key. But what I can say to you, dang it, you stick it in the ignition and you turn and you start it, your car, you would notice a key. But if I look at this and I'm not sure what it is, and I'm not sure what to do with it, and I want to clean my ear with it or clean my fingernails, not normal aging.
Okay, so then what is dementia?
So what dementia is it's a disease that means your brain is dying. And what a lot of people think is dementia means it's forgetfulness. But the reason you're forgetting is because your brain is dying. Dementia lasts about 4 to 12 years. And part of that is when you were diagnosed, because you can have mild cognitive impairments and a lot of things that lead into dementia. But basically, dementia means that your brain is dying. It lasts 4 to 12 years, and you start forgetting things that are important to you. It's not curable, Beth. So we have medications that can mask the symptoms, and it seems to slow the progression because it's masking the symptoms, but it's really not.
And dementia is a category, correct? There isn't just dementia. Can you talk about some of the different kinds of dementia?
Absolutely. So it's a category of a disease that has over 100 different manifestations. Now, the reason why is because dementias can combine together and form different types. Most people know about Alzheimer's disease, and Alzheimer's is right now 60 to 80% of the cases. So what happens with Alzheimer's is protein deposits build up on the brain, things don't transmit very well, and that's what is going on with Alzheimer's. Lewy body disease, that's another kind of dementia. And Dr. Lewy body was actually working in the 20s with Dr. Alzheimer's when this disease was discovered. Lewy body's popular because of Robin Williams. Everybody knows him. And what's interesting with Lewy body disease is that disease manifests itself with hallucinations and like ADD type symptoms. Another dementia would be vascular dementia, which a lot of people are familiar with. Think of multi-infarcts, small little mini strokes that take pieces away. and goes on for years. And Parkinson's disease, interesting, it can be a form of dementia. We think of it as a movement issue, but it can develop into a dementia.
Okay, and dementia isn't just something that happens to your mind, it's actually something that physically happens to your brain. What happens to your brain when you have dementia?
So now this is what I find really interesting, and I think it really helps people to understand. If you think about your brain dying, usually what happens with all dementia is this part, your frontal part of your brain dies first. So what does the frontal part of the brain do? Well, first off, that is the last part of the brain to develop, which is really interesting with dementia because you want to remember last developed, first lost. So this part of your brain, again, develops in 25 to 30 years old. Some people develop this part of their brain a little better than others. But this part of your brain says, oh wait, maybe I shouldn't say that. Oh wait, if I do that, maybe I'll get hurt. It gives you the ability to look at things and see things from the other person's point of view. It's your reasoning. So you're not going to really reason with people with dementia because they've lost that ability. The other part of the brain that starts to die is your left temporal lobe. Now what's really significant about that is if you think of your left is your language and lose. That all starts with L's, and try to keep things clear so that people can remember. So left, lose, language. What's language? When your language center is dying, that means my ability to make up sentences and have them be something you can understand and that makes sense. That's language. You talk to me, you give me directions or say something to me, my ability to figure out what you're saying, that's language. I've lost that ability. That's why it's so important to give visual cues. Are you thirsty? Do you want a drink? What time is it? Now here's what's really important for people to remember, the right side of the brain. Right, retain. And what's that? Rhythm. Rhythm is music, it's poetry. That sticks in our minds even to mid to late dementia. We can make the brain come alive, and it's so exciting. Because if we can get this right side of the brain to fire, that chemical excitement can get the other parts. So somebody who can't walk or has trouble walking can even dance if you put on music and get them going. So that's the part of the brain that really excites me, because what we want to do is we want to focus on what's left and how we can tap into what's left with a person.
Okay, great. Thank you so much, Pamela. We'll talk more about dementia after this. Stay with us. Welcome back. We've been talking with Pamela, who is a certified dementia practitioner and certified positive approach to care, or PAC trainer. Through Mountain Pacific, Pamela offers PAC training to nursing homes across Montana. Broadwater Health Center Nursing Home in Townsend, now a 5-star facility, has taken advantage of PAC training twice and has seen a tremendous difference in resident care. Rachel Smith, an occupational therapist with Broadwater, joins us now to talk with us a little bit about dementia care. Thanks for being here, Rachel.
Thanks for having me.
Before we talk to you, though, I do want to ask Pamela really quick, can you give us an overview of what is Positive Approach to Care, or PAC?
So positive approach to care it's just really a neat thing, and it's just the positive approach. Now, remember in the last segment, I said that we retain on the right. What positive approach to care says is we need to focus on what they have left. What's gone is gone. Once the milk is spilt, we can't put it back in the cup. So the word remember, it's gone. We don't use it. And what we do is we focus on the positive. So if I were a positive approach to care trainer, which I am, and I'd go out and I would be training in facilities, I would teach the positive approach. One of the things is if I'm approaching her, I want to make sure she can see me. Remember, the understanding isn't there, so I want to be sure I give a lot of good visuals. So I want to approach from a direction where I know she sees me coming. I want to be sure that I'm very respectful of her and her space, because we're trying to encourage keeping their dignity. So once I get about a double arm's length away, so her arm's length and my arm's length, I want to pause. I want to make sure that she's seeing me. I want to greet her friendly and say, "Hi, Rachel." If I think there's a chance that she may not remember my name, I don't want to put her in the position of getting stressed out and trying to remember. So I'm going to say, "Hi, Rachel, it's Pamela." I'm going to get my hand where she can see it. And I'm going to reach out like a handshake, because that's how we greet each other socially, and that social part of our brain stays intact. Now, what I'm doing is I'm actually touching this part of my hand, the palm, and the palm of hers. And when you hold that way and you let their hand rest on top, that's comforting for people. So even someone who's just stressing out, you can just hold their hand, and if you'd like, you can cup the other hand over the top. And just touching someone in this manner will calm them down and make them feel comfortable. The other thing that we do that's a positive approach is when caregivers are taught how to feed someone, and that's a big thing. We don't think of ourselves as caregivers, because giving means we're doing to someone, and care partner means we're doing with. So as a caregiver, I would be taught to sit across from someone, and if I were feeding them, to take a spoon and poke it at her. And her reaction to my behavior, we call it their behaviors, but actually it's my behavior that caused it, is she's going to jerk back, or maybe she's going to hit my food away, or she's going to toss the food. So that's how we feed children. We never want to not give people respect and dignity. So what I would do as a care partner, because I'm doing with and not to, is I would get in this handhold. I would use what's called my skill fingers. I would sit down beside her. Can you just reach in a little bit? Thank you. And if her food were in front of her, which it would be, I would use her hand and do this. Now what's happening is her mouth automatically opens, because her hand, her body, is both sending and receiving. And when her brain is sending and receiving, her mouth knows, oh, I'm getting food. I should be opening. So we tap into that motor memory, and when it comes down, we do this. And then the other thing that's really neat is once we get that motor memory going, I can take this and I can let her hold the spoon, and then I can just guide, and then eventually, hopefully, I can let go and she can completely self-feed. And that's what we're trying to do, is we're trying to build and maintain dignity. Now, a lot of people say, well, somebody with dementia, it's just like taking care of a child, right? No, it's not. And it really, it saddens me when I hear people say that, because children don't have the years that they've acquired knowledge and all of that dignity and respect that's deserved. And so what Positive Approach to Care does is it tries to say, how can we bring their dignity back to them in everything that we do? And how can we focus on what's left to get the best out of it?
So Rachel, you've taken part in some Positive Approach to Care. Can you give us an overview on what you've seen with using this approach with people you work with?
The people that I work with they vary, the levels of dementia that they have. So it's nice to see the people that, my coworkers, use these skills and techniques to bring back the dignity in it. And you can see it in the dining room and in the facility, everywhere. It's just wonderful to see that.
And so how does it make you feel as a care partner to be using these approaches?
I'm more confident in who I am and my skill level. I have a lot more knowledge and skill. I've never met a stranger when I have these skills. It's like you don't even know them personally, but when you approach them, you don't have that fear or that insecurity, and you feel confident in the skills that you'll be able to help them.
And Pamela, I know this is kind of a personal topic for you. Can you talk a little bit about why the Positive Approach to Care is so important to you?
My father had vascular dementia, and as much as I loved my father and my family loved him, and we tried to do everything right, we made a lot of mistakes. And because of those mistakes, we missed out on a lot of opportunities, and we lost a lot of joy. And so that drove my passion to learn about and teach and help train others.
Okay, great. Thank you so much, ladies. We'll be right back after this. We're going to talk some more about dementia care and what you can do to help your loved ones if you think they're having any issues with dementia or other categories of this disease. We'll be right back. Welcome back. We're still talking with Pamela and Rachel about dementia and dementia care. So Rachel, let me ask you, these techniques, they're not just used on people who have dementia. They can be used on people who need care for a number of things. Can you talk about how else these techniques have helped you?
I've done rehab with several different types of people with a traumatic brain injury or stroke, any kind of a neurological disorder or a cognitive impairment. Like with a stroke victim, and you want to work with the affected side to help increase the return of any independence that they can get back out of that. So the hand under hand with the helping fingers to help feed, it helps that muscle memory fire back. And so when they are able to, help, you can feel their muscles firing a little bit, it gives them excitement and it gives them hope. And it's a wonderful technique that can be used with everybody.
So do you have a specific example of when you've seen somebody really strive under this technique?
I do. We have a gentleman with advanced dementia, and you can roll him up to the table, and I saw some of the CNAs doing such, just rolling him up there and hoping that he was just going to eat and putting the food in front of him, and then they'd walk away. He wasn't able to initiate that self-feeding, so got on his dominant side, and you talk to them, you introduce yourself. I knew him, of course, so I didn't sit down and say, hey, I'm Rachel. But you use their name, and I did the hand under hand with the helping fingers, and you get down to the plate, and you bring that food up, and his mouth opens, and he's eating, and you could almost see the cogs turning. It was incredible, because then you did like 5 or 6 times, and then like Pamela was showing you, you lessen the amount of grip that you're having, and you put the spoon or the utensil into their hand, into his hand, and then he was able to do it more, and then eventually he was able to self-feed the rest of the meal and drink. It was just like that muscle memory kicked in and he was back. It was amazing.
Well, and it's really exciting because one of the things that you brought up, Rachel, was you could feel what they're doing. And when you're using this positive approach to care, you get a lot of input from the residents or from who you're helping. So they can kind of push away and say too much, too little. Or you can even use the positive approach to find areas of pain in people who you can't ask questions and get answers.
So, and Rachel, you talked a little bit about some of the other staff. Are they starting to use these techniques? What's the overall feel at your facility?
They seem to be more relaxed. People with dementia, like Pamela was saying again, when you bring the spoon to their face and they flinch, some of them have, combative reactions. So with the hand under hand and the calmness and the speaking slowly, addressing them personally, it seems to calm them down. They're more able to accept the assistance and be more willing to participate in the activity that you are doing, whether it is a mealtime or if you're getting them up in the morning and you're getting them dressed. It can be scary for them. You're groggy. You know how we are when we get up. So they're even, more confused a little bit sometimes. And so when you approach with the joint pressure, and there's some of the things that we haven't talked about, but it just helps calm them down, and it helps make the patient safer and the assistants a lot safer.
Good. So Pamela, this is something that you're going across Montana and doing at different facilities. Why are you really encouraging nursing homes to use the positive approach to care?
Well, the biggest reason, Beth, is we want to decrease the use of antipsychotics. Antipsychotics, they're a group of medications that were made specifically for Huntington's, Tourette's, and schizophrenia. But now they're starting to be used widely with people with dementia, and it's dangerous. There's even a black box warning out that was put out by the FDA saying it's dangerous to use these medications. They actually cause, they speed up the progression of the disease, they cause falls, and what they do is they're basically a chemical restraint. And so instead of dealing with the person and figuring out what their needs are and returning their dignity to them, what we're doing is we're really taking their dignity away. We're not giving them the respect that they deserve, and we're sedating them so that we don't have to work harder.
And so if I have a loved one at home that I fear may be progressing through one of the dementia diseases, how can I tell? What should I do? Where do I go?
Well, you can contact me and I can get you some information. But Positive Approach to Care, Teepa Snow is who developed it, and that's TEEPA Snow. You can go out to YouTube. You can find lots of short little videos. She'll help you with lots of ideas to help. Naomi Feil, she's also a great resource, and her last name is Feil. And the other thing is music and memory. I really encourage people to learn about music and memory because music is just so powerful in it. It brings people back, and even if we only bring them back for a short period of time, that's great because we have them.
So do you have any advice then for people watching at home who might have a loved one that needs this sort of care, whether it's dementia or, as you talked about, a brain injury or something? What would you tell those people?
I tell my family members of residents and patients that I see in the hospital and stuff, take care of yourself first. If you don't take care of yourself, you're no good to anybody. When you're on the airplanes and they drop that mask in front of your face and they say, well, you know, if you have more than one child, you have to pick which one's the favorite. Put your mask on first because you're not going to be able to help either one of them. Take care of yourself. Find respite care providers. They are out there. Find time to do things that you enjoy. Educate yourself. I think educating yourself is very important on the diagnosis of your loved one, whether it be the stroke, the TBI, dementia, what have you. Because knowledge is power and confidence, and it will help you be able to react in a positive way when you see the new symptoms developing, and you won't be so lost. So taking care of yourself, educating yourself.
And focusing on the positive. You know, like I was saying, it doesn't help anybody to remind somebody that they're not remembering.
Perfect. Thank you so much, ladies, for being here today. We appreciate all your information. We are out of time. If you're interested in learning more about what you heard today, you can visit our website at mpqhf.org, or you can call Pamela at Mountain Pacific Quality Health. Thanks so much for joining us. Until next time, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.